Western Spring Television, ours it is.
Did you know that the phrase, "did you know," is used when you're asking someone if they know a fact and you already know that fact? Did you know that the heart beats more than 60 times in 60 seconds? Did you also know that at rest, the heart can move 5 to 7 liters of blood in 1 minute and 7,600 liters per day? In other words, about 70 milliliters of blood is pumped into the arteries during each heartbeat. If you know these, simple reason is because you watched the last episode of Spring Clinic. If you did not, well, my name is Temitope Ajijololuwa Ola. Thank you for joining this fresh broadcast of Spring Clinic, where we delve into everything health and well-being, so we can help you not only to feel better, but also bring you information that will help you reduce the risk of diseases, lengthen your lifespan, save you money, and benefits the environment. Today, I will unravel a vital biological system that removes excess and waste products from the body to maintain homeostasis. Most of these excess and waste products are in fact used and broken down components of metabolism that leave the body in the form of urine, sweat, or feces. What do I know? Our owner medic, seasoned family physician with over a decade's worth of experience under his sleeve, Dr. Ayodeji Ogungbemi, is on set to take us through this session step by step. We're delighted to have you on set, Dr. Sir.
Thank you very much.
As always, we're delighted to have you. All right, you educate us on our excretory system, because we do not know. Because at the end of this, we want to say, did you know?
Once again, thank you very much. And
thank you, sir.
Good afternoon.
I
appreciate you and the entire management for having me, and for all the effort you put in place in having me here.
Thank you.
Again, I have to appreciate my teachers for teaching me well.
Yeah.
If not, maybe you wouldn't have accepted me here. Well, straight ahead, when we move into the excretory system, I think we've talked about quite a number of other systems.
Yeah.
Respiratory system, circulatory system. I think it's now time for
talked about digestive
as well. Digestive system.
Yes.
Now we're talking about the excretory system, and I need to say this, that no system works in isolation. All systems work together. So whenever there's a problem with one, it will be revealed in other systems. So that's a fundamental fact that I would like everybody to understand, that once a system has a problem, it will affect other systems in the body. And the person starts to feel ill, just sick, because there will be a change from the normal. And the excretory system is a very vital system because it brings homeostasis, as you talked about. It brings, to make it very easy for people to understand, it brings balance. When we talk about homeostasis, homeostasis is about balance, ensuring that the normal milieu or the normal environment remains the way it should be. For example, in this studio, there should be, or there would be, a maximum number of people that should be in per time. So if you have excess, then there'll be a problem. So the excretory system helps to remove the waste products or excess. Because what we call waste may be an excess, a normal, that a good thing that is above the normal that is required. Or whatever is not needed that is not good. So we must put it in that light. So, because one wonder why would water be part of the waste? Water seems to be necessary.
You know, it's like that sentiment about weed. You know, when they say weed is an unwanted plant growing, is a plant growing in an unwanted place. Just like ugu could be, you know, weed sometimes.
Yes, thank you very much. And I won't have to say just weed it out.
Yeah, exactly.
So because water, we still get there. I'm just trying to lay a foundation. So all waste products are not necessarily bad in itself, but once it is above what is required, it becomes a problem. Just like I tell people, food is good, but once we eat more than is required, there'll be a problem. Water is good, but once, so in that light, I want us to view waste products like that. So let me come to the definition of excretion. Excretion is defined as a way in which the body removes waste products or product of metabolism. Now, with that, there's an exclusion which I would like to add, because when we talk about process of metabolism, metabolism occurs in the cell. It means that it is from the cell that this waste will start to come out from all the cells in the body. One, it excludes undigested food.
Okay.
So if I eat, let's try to go back to digestive system, where I can see that you are wondering. In the digestive system, we eat, goes down, we chew, we break it down, mix with saliva, then the food is broken down. Now, it is not all the food that is utilized. So it is not all that is absorbed or assimilated into the body cells. So some will come out as pieces, particularly the roughages and things like that. So they are not part of the product of metabolism, but it's also a waste product.
So it's okay. So what, they're not part of productive metabolism, but they're also waste.
Yes, but did you get the concept? I go right again.
Okay.
Okay. Now, wastes. The definition would say the body eliminates, or however the body eliminates, product of metabolism and toxic substances in the body. Metabolism occurs at the basic unit of an organism, which is in the cell. So each cell is undergoing, that's why each cell is alive. So each cell is working. So it's breaking down amino acids, breaking down amino acids that come from protein, largely, breaking down glucose coming from carbohydrates, largely. Then water is also coming in. So it's breaking down all these things largely now. I'm using the word largely because
at least for the most part,
yes, for the most part, not entirely. So the glucose is broken down into energy, and then at a point can be converted to fat. Amino acids from proteins, largely, you know, another whatever, is broken down into, because the cell needs amino acids to grow, to reproduce. But as it's breaking down all these things, there are also waste products. So the products produced from those places in each cell is regarded as products of metabolism. And they are toxic to the body. So there's a system that the body has to take out these waste products. Now, that is one. The second sign that I'm bringing to it is that the feces we all pass is not as it contains a lot of undigested food. That is, for example, I'm a Nigerian. This is western part of Nigeria, so I take eba, take rice. Now, all the eba I took, or that I've taken, all the rice, all the food is not all that got digested and assimilated. The body, based on the time that is the digestive process, you know, works on it, part of it will be taken in, part will remain. And then whatever remains goes through the rectum and then comes out. Just as so, if we talk about excretion, as it were, it includes the waste product of metabolism and this undigested meal that we took. So we must understand it. And it's a system. A system will consist of different organs, and largely there are 4 organs, but I'm making it 5 because of the inclusion I've made now to include the undigested meal that we have taken in, because it's also a waste product. Okay. Because once it stay longer in the body, then there will be problems. So maybe I should start with that, so that there will be a link to the digestive system. I think we really talked about it. So undigested food, whatever we are taking goes through the entire digestive tract. Then the undigested part is what comes out. Obviously, it has been broken down, it has been mashed together, it has been processed, as it were. But it comes out in the feces. And we mentioned last time that in the rectum is like a dryer. Once the body is dehydrated, the rectum absorbs more fluid, more water, so that then the feces becomes hard. We talked about. So that's for the large intestine, or the large intestine as a part of the excretory system, from my own analysis. Yes. Well, let's now go into there are other critical aspects. We have the urinary system, where we have the kidney, the ureters, the bladder, and the urethra. Okay, let me go back.
There's a ureter.
Yes, and there's a urethra. Ureter.
Is it like the intra?
No. Okay. They are both tubes. I mentioned when we were talking about cardiovascular system, and I said about 20% of cardiac output goes through the kidneys. So that means the kidneys are a very vital part of also the cardiovascular system. And one of the functions of the kidney is situated in the excretory system. So blood is, when we say blood is life, it's not just about the fact that it has red blood cells. It means that it is a critical part in maintaining balance, homeostasis. So as the blood is going around the body, it is supplying oxygen, supplying nutrients to the cells, and yet taking up carbon dioxide, and then taking up waste products from the cells. So whatever waste products the blood picks up from every cell, it has to get out through a route. Okay. And one of the major routes is through the kidney. Okay. Can I continue? Yes. So it gets the blood to the kidney. Usually one should have 2. Okay. I said usually, normally one should have 2. There are cases where some people may have 1, some people may have abnormal ones by reason of birth, or things like that.
Is somebody be born with just 1?
Yes, someone may be born just 1, but that's an anomaly. It is. Anomaly simply means it's abnormal. It's not expected. Does not mean that 1 will not work. But sometimes the 1 also may not work, may pack up, have issues. So now when it gets to the kidney, what the kidney does, I'm just making broad illustrations, because if I go into details, we have, for example, this kidney now, we have a nephrologist, somebody that is a specialist, a consultant in just kidney matters. You can imagine. So what will I say in even 1 hour on kidney matters? So, but largely speaking, amongst other functions that the kidney does, because kidney does other things. It filters, I'm using these words now, it filters the blood to take out these waste products. So it takes out the waste product and excess water.
From the blood.
From the blood. So once it gets, we have 2 kidneys. The one can survive with 1 if the one is healthy. But I still don't know why God gave 2, but we have 2. So then there's a connecting tube from the kidney, from each kidney to the bladder. The bladder is a pelvic organ, except when full and heavily distended, it remains a pelvic organ, but it can be full enough to come into the abdomen. That's the pubic area, just above the pubic area. So, but the kidneys are at the back. The kidneys are not in front of.
Oh.
The kidneys are situated, they are in the abdominal cavity. They are glued, or they are I'm trying to use normal words too. I don't like using
Big,
medical grammars.
okay.
They are plastered to the posterior abdominal wall. No, they are hung up there. So then we have two tubes. Whatever is the waste product gotten from the blood that supplies the kidneys, it comes through the ureter. U-R-E-T-R. So we have two ureters. One from the right kidney, one from the left kidney, and the two enters the bladder. We have one bladder. Then from the bladder is like a storage organ, just stores the urine. So what we have largely in the urine is they're just waste products, water plus waste products. That's all. Largely uric acid, largely ammonium compounds and water, largely.
You mean the urine does not have any medical value or benefit?
Normally, no.
No.
The benefit is that it helps to, it's just waste product. So
it can be used for anything.
It can be used.
Because I've heard people saying people drink urine. I mean,
people say a lot of, I'm trying not to use very, people say things. People say things. Just like I tell people when you go online, it's not everything you find online that is true. I can sit down and put things online. You can sit down and put things online. So there's nothing like drink your urine. Whatever you are drinking is just waste. I hope you have not drunk your urine.
No.
So the urine is just a waste plus water, you know. And I also mentioned at the time that the water component there is based on how hydrated the person is. Now, these waste products are there. If the person is well hydrated, urine will look like clear water like this, maybe a little bit of amber color. And once the person is dehydrated, it means that, for example, I don't know if one can check. Let me use this as an illustration. This is a cup of water. This is a cup of water here. If I put sugar in this water now, it will likely not change the color. You know, it will still look like water, as clear as this, or salt. But if we reduce the concentration of, we reduce the quantity of the water, the concentration of the sugar will increase.
That's before adding the sugar. If we reduce the quantity of the
and
content
I put
in
the same quantity of sugar there, then the concentration of sugar in the water will be more. So the true color of the sugar will start to show. So that's what happens with urine. If one is well hydrated and a lot of water comes in with the waste products, then urine looks close to water, you know. It can, except maybe for the odor, one can even say, this is not water that you put inside this thing. But once the person is dehydrated, to the level to which the person is dehydrated is to the level with which the urine will be concentrated. It will have more, in terms of concentration, waste product. So it now looks more yellowish and people start to say, person is ill, you know, that your urine is, why is your urine this yellow? So usually,
Doctor, permit me please. Could you really say that today I drank a lot of water and when you pass out urine, it will still have, you know, that very dark color?
Yes, if there's a disease condition ongoing.
Okay.
So, because don't forget I said the color of the urine is based on the volume of the water and the waste product. Okay. The waste product will also be affected by, you know, when we come to a disease condition, a lot of things can now come into the normal. The normal urine, there's something we call urine is normal.
Are there people who pass out urine that is clear rather as...
Maybe close to this.
Okay, very close.
If you drink enough of that would... But sometimes, maybe I should quickly keep this in. The issue of the concept of normal intake of water is dependent on 2-3 factors. I'll explain. One, your environment.
Okay.
So if the environment is hot,
yes,
a lot of water would have gone through your skin. So if you tell me that you took 3 liters of water
You may
There would have
find
been
it.
a lot of H2 would have escaped through your skin because the environment is hot. So the urine, the person is saying, I've taken enough water as prescribed, but my urine is still concentrated because the loss from the skin is also part of the way water can escape. Even as we are talking like this, if you put a glass, very clear glass in front of a mouth, just a matter of water, H2O is escaping. Whenever we breathe, it's the same. So in our feces, water is there. The water escapes through a lot of routes. When people vomit, water is there. So let's come back to the urine. So so the urine contains contains water and excretory products. So that's the urinary system on its own. And it's such a fantastic system, very, very critical system to the body. Now that's on the kidneys. So urethra. Okay, I was talking about the bladder. So the bladder is just one, has two tubes from both kidneys that puts urine into the bladder. The bladder is just a muscular organ, purely muscular organ, so it can expand. So after a while, once the bladder is full, not necessarily full like full to the brim, when the bladder is full to a certain amount, it stretches, then the person feels like urinating. Then through the urethra, just one, Urethra,
Yes.
urine comes out. So urethra is one.
You know, that was what I was asking. Is it like the concept of inter and intra? Yeah. Inter would be outside somewhere. Intra.
Both of them are in the
like
same. They are maybe intra-abdominal or both. Okay, I think the diagram is there. The two yellow tubes are the ureters. Then the bladder is the lower rounded brown organ, and there's a tube at the lower part of that bladder that is the urethra. So we urinate through our urethra. Okay. So what we know is that at the external orifice of the urethra, that's where urine comes out from. Now, there's a common problem with this. Whenever there's a problem, you know, I talked about this, people that have kidney failure, whenever the kidney is failing, it means that the kidney will not be able to perform all of its functions. And one of its functions is excretion. So the person will become bloated because the kidney will not be able to handle the excess fluid and the waste products. So you have things like the legs are getting swollen, the abdomen is getting swollen. To generalize it now, it simply means what should be escaping out, what should be passed out, is being retained in the body. And this product of metabolism, these waste products, are toxic. It gets to a point that the person starts to feel very ill. And it gets to a point that the person may start to become restless, talk irrationally, because these waste products are bad. They are toxic, particularly. Yes, to every cell. That's why they are called waste. They are unwanted, but particularly to the CNS, the nerves, the brain. So it becomes a major issue. So that's for the kidney. We also have the skin. The skin is an excretory organ. Not only for excretion anyway. You know, I mentioned that all organs may have 2-3 functions, and systems have different other things. So part of the excretory system, you have the skin. The skin, excess water, just what we talked about.
Well, let me hold you there, Doctor. So we'll start with the skin. You know, when we get back from this break, therefore we need to go on this quick break. And when we get back, Doctor is going to continue on the skin.
Up to 75% of human infectious diseases originates in animals. And as more bushmeat is brought into our cities, the risk of human infectious disease outbreaks increases. Ebola, monkeypox, Lassa fever, yellow fever, and even COVID-19 may have been transmitted in this way. Illegal bushmeat trade not only endangers our wildlife, but affects our health and may damage our economy. So please, say no to illegal bushmeat. Keep them wild and keep us safe.
James Ajibolaige was a lawyer who obtained his first degree in classics from Nigeria's premier University of Ibadan. Born September 13, 1930, the orator and the polyglot spoke impeccable English, French, Igbo, Hausa, and Yoruba languages. His fine diction placed him among classical orators and public speakers like Cicero, the Roman orator. This attribute earned him the prefix Cicero of Esauke. He authored Kaduna Boy, an autobiography, Detainee's Diary, Constitution, and the People, among 6 other books. Bolaige was a colorful politician, elected governor of Oyo State in 1979 and appointed a federal minister in 1999. He was a pioneer founder of Afenifere, the Yoruba social, cultural, and political group. He invested his political sagacity to propel the group to the height of political leadership and decision-making in the southwest of Nigeria. Bolaige was assassinated on the 23rd December 2001. His murderers are yet to be apprehended till today. Western Spring Television identifies Bolaige as a watershed character in history.
Well, dear viewer, I think you already consider yourself very blessed to be on this particular episode of Spring Clinic on Western Spring Television. And before we went on that break, today we're talking about the excretory system, and Doctor has been taking us through the excretory system. We've talked about some organs in the body that pass out waste, and we've talked about the bladder, we've talked about the kidneys, and Doctor was about to get to the skin when we went on that break. Over to you, Doctor.
Okay, thank you very much. As we need to make a doctor. We need to make yes, I mentioned earlier that the kidney or the urinary system is a major part of the excretory system. And I also mentioned that the intestine does not convey product of metabolism, as it were, but also helps in taking up or taking out undigested food substances that have not been broken down. And it's important to know that. Number next that we're talking about is the skin. Where the skin, some regard the skin as the largest organ in the human body. Maybe one of these days we'll talk about the skin and its functions, because the skin is really, really important. And it has several functions. But out of those functions is the excretory function. And you'll be surprised. Okay, I mentioned it earlier that, people use different terminologies. Say the skin breathes, the skin can breathe, the skin can do this. All these are just terminology to say that the skin is a living organ. So it helps in excretion. And largely, the excretion is through the human sweat. I don't know if you have tasted your sweat before.
Yes.
Let me ask you a question. Let me ask you an interesting one. Have you tasted another person's sweat before? Accidentally. Accidentally.
Like sometimes somebody's, taking out sweat and just
splash it. So.
Exactly.
So my main focus for asking that is that you notice that it's salty, which simply means, because I like breaking down things. The sweat is in a fluid state, which means water is there, and it's salty. Now, salty does not necessarily mean a normal salt.
Okay.
It just means that it contains salt. Salt means, salt is like a compound, it's a general terminology. The salt we take has a specific name. So, urea also gets out through the skin. So, compounds, waste products, urea, excess water, excess salt can also be, in fact, not can, also get excreted through human sweat. And it's also very simple. As I said, no system is isolated. It is still the circulatory system that gets blood to the, I'm trying to remember the name of the sweat organs. So, because they're in close proximity, so the waste products get absorbed into the sweat organs, and then from the sweat organs, it comes out into our skin. So it's good for human beings to sweat.
Should you be worried when you're not sweating? And there's heat or could that happen? Can that be a condition?
That will not be a good condition.
Okay.
If you exercise yourself, you should sweat. If you are, though sometimes sweat could be discomforting, I understand that, but it's a way of the body dealing with waste products. There are also other things about the skin that we'll talk about maybe sometime later. Then we'll talk about how people handle the skin and then cause trouble for themselves later. Now, as the skin serves as a means of excretion, the skin also serves as a means of absorption. So, because I need to keep this in, that whatever you apply to your skin is absorbed into your body. When you go to buy creams or ointments, people need to read, because people just, I'm not focused on the marketers. The marketer wants to sell. But one of the goals of this program is to educate people. That is, if I need to buy something, then I need to check. Hope this does not, will not harm me in any way. And if it does, just put it aside, you know. So we need to hold that whatever you apply to your skin will be absorbed. In fact, it's a way of drug administration. You know, there are different ways of drug administration. The very common one that we know is that you swallow tablets or capsules, then injections. Abi? Yes, there are some drugs that are in form of ointments. In fact, there are contraceptive pills that are in form of, we call them a patch, just like a small, like a sellotape, sort of. And then we get stuck to the skin, and then it releases chemicals that ensure contraception. So the skin is also a very excellent organ of absorption, and people should be aware of that. You know, in fact, once you're aware of it, even the roll-on you use, you'll be careful. The what do you call this? Colognes we use, we'll be careful, because these colognes you put on your body, so maybe one will have to go for the ones you can put on the clothing and not on the skin. So that is extra for people.
Well, this, I'm sure it's really a very, very wide and broad topic, but we're going to have to, you know, like summarize it so that, you know, we would have, I don't know, Doctor, are you thinking we should extend to another,
this topic,
or we should
I can round it off, just 2-3 minutes around. So that's about the skin. Then we have two other organs, very important. We have the lungs. The lungs is an organ of respiration. We've talked about it. But as the lungs, if you can remember, and we all should, as the lung takes in air and then traps in oxygen, it takes out CO2 and water. So as it's serving as a respiratory organ, it's also serving as an expiratory organ. That is, it helps to take out the CO2 produced during metabolism. Then the last one is the liver through the gallbladder. That is through excretion of bile. So maybe we'll talk about bile later, because bile does a lot of things.
Very white. I would have loved to keep extending, but
so bile is, maybe just give me a minute right now.
okay.
Bile, people would ask, how do we get bile? And what's the importance of bile? Because if you kill an animal, the bilous substance there, the bile there, is very bitter. You know, I wonder, why would a human being have something bitter like this? And if you want to kill an animal, they say make sure that the content of the gallbladder does not spill, and the content is bile. So it is very important. It is gotten from when red blood cells are broken down, hemoglobin, so it breaks down and then you get the bile. But the bile is important in absorption of fat.
It is important absorption
Of fat. So if people that have bile problem, their stool will still contain the fat that they have taken. So their stool will largely float. And their stool will contain fat. So the stool will look pale, white, and be floating, a little bit of foaming. So sometimes when doctors say, can you tell us how your stool looks like? People wonder, what are they looking for in my stool? And you tell them, my stool is usually white, though. Then it's like a little bit oily mixed with, there's a bile problem here. But bile also, just a little that is needed anyway. So the bulk of it has to come out through somewhere. It also comes through the pieces. The liver is important. The gallbladder is part of the liver. Liver, when people talk about liver, people say things like the liver is a detoxifier. Yes, it is true, but not in the way people talk about it. Most drugs are dealt with in the liver. Some drugs become potent after they are gone through the liver, and some drugs become denatured after they are gone through the liver. So the liver is important, and it helps in dealing with waste products. So anybody that has a problem with the liver will have problem with excretion of toxic substances in the body. I think I can out of that.
Well, I have a lot of take home today. I mean, the fact about the kidneys being at the back, I never heard. I mean, I didn't know that. I thought it was right here in front. Because, well, that's my take home. Now let's get back to the start. You would have finished off my sentence about your ignorance with now you know. What on the street says in your mind. Now don't stay comfortable with half information. Don't. How could you possibly know in 10 seconds what it took us about an hour to learn today? Not to mention Dr. Ogunbemi's years of training and his wealth of experience. Well, follow us on Western Spring Television. Follow Western Spring Television on all our social media pages to stay up to date on life-saving information. Keyword, life-saving information. I am Temitope Ajijola Oluwaola, and I'll be back to scrutinize your effort on the next broadcast of Spring Clinic. Bye for now.